as a psychiatrist, right, let's say someone comes to you and they have had this issue with the way that they are functioning. So functioning basically means like, okay, maybe your appetite is gone or you just don't have the motivation to do things or so, right? Do you take like a few sessions first to see like, all right, is this something that needs meds?
Yeah, I suppose it also goes back to severity of symptoms. A lot of times, initial assessment, we spend enough time with the client, we get a diagnosis. Like if it's depression, it's pretty easy to fulfill criteria. We can get a diagnosis straight away. Collaborative care, especially with the way everyone advocates for themselves. So I think it's important to kind of have a shared decision-making process when you're discussing medication. So if you've got mild to moderate symptoms, certainly medication is an option. It's important to kind of talk to your client about it. In the context of how fast it takes to come up with a diagnosis, it really depends on, I guess, symptoms, the severity and the level of dysfunction it's caused. So sometimes, cases like depression, you also have a whole spectrum of mood symptoms, right?
Yes,
so you can come in with like feeling bad after a breakup, for example. And that's a normal human experience, but it can also then become a bit more overt, and then you kind of get an adjustment disorder. It's another diagnosis on its own, right? But if we don't intervene at that point, then we are heading towards the major depressive disorder. Kind of where you're meeting your client is also important. The decision on whether you want to take medications right up also kind of depends on both your client as well as the severity of symptoms that you're seeing.